Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm Carl Petitto, your host. I'm an occupational therapist and a board-certified hand therapist. I specialize in the rehabilitation of orthopedic conditions affecting the hand through the shoulder. Today, I want to talk about how to safely strengthen the hand, the wrist, the forearm, the elbow, the shoulder, and basically for certain conditions, what is the safest things to do? What do we typically do in the clinic? And what things should you not do and why? I'm bringing you this podcast because I want you to understand the fundamentals of how your body works and recognize what your body needs so you can obtain what you need when you need it. Timing is really important in healthcare. Taking care of things sooner rather than later is really optimal for the best outcome and to get you well in minimal time. This is not treatment or advice. This is information sharing so that you can be empowered to make decisions for yourself in accordance with your healthcare practitioner. So, it's really important to partner with a hand therapist or a hand surgeon, physician assistant, whoever you need in order to get well in minimal time. And if you're experiencing pain and something's not going away, don't wait a long time. Get in within a number of weeks and be seen. And the typical point of entry might be your family physician. And if your family physician or physician assistant needs to refer you to a hand therapist or a hand surgeon, a specialist to really get to the bottom of what's going on, then make it happen. Let's get it fixed up. So when conditions heal, whether it be an injury or someone had a surgery, we've restored range of motion, soft tissue like tendons and muscles and skin and scars. It's all nice and stretched out, and the range of motion is nice and normal, and at least close to normal. And clinically, we can start doing some light strengthening while we're still finishing up a little bit of restoration of range of motion. Or let's say, for our purposes today, that all of the range of motion is back. And now what do we typically do for strengthening? Let's start with the fingertips. So, we need a strong pinch. Here's a lateral pinch. I also call it I call it a key pinch, like holding a key, turning a key. Also, here's a 2-point pinch. Here's a 3-point pinch. And usually what I strengthen is the lateral pinch, the key pinch, and the 3-point pinch. And we would usually use some what's called TheraPutty, some resistive putty, and the putty comes in different colors, which denotes what kind of resistance it is. We have soft, medium, and hard, strength putty. And usually for strengthening, all the people do it once or twice a day to light fatigue. And then if they start having some discomfort, they'll skip a couple of days and then go back to it. I'm just simulating with this for putty. So it would put it here, it would pinch through the putty and then fold it again, make it thick, it pinch through again. Same thing with the 3-point pinch. Sometimes with certain conditions, I want to do isometric strengthening, which is holding the same position. If I hold this dumbbell in the same position until my biceps gets tired, that's isometric strengthening. And that strengthens the muscle really, really well. You can do that with pinch. If folded a cloth and put it in here and pinch that and hold it for about 10 or 20 seconds, I'm already feeling my muscles start to fatigue a little bit. Same thing here, 3-point pinch. Can get in there and hold that until it gets a little bit fatigued. It usually starts shaking. Let's talk about grip. So isometric can also be done with a thicker cloth or towel and squeeze and hold until it gets a little shaky, gets a little bit tired. We issue these. We just give these out. Hand grip strengtheners, you can add resistive bands. You can cut rubber bands and tie them around a square knots just so you're pulling against more resistance. We can also take exercise bands, resistive bands, and tie those around these bars, heavier bands, and do isometric. Let's say somebody has arthritis I don't want to doing a lot of repetitions and really aggravating things. I want them to just hold it until it gets a little bit tired. It's strengthening without really aggravating the joints and increasing their symptoms of arthritis. What you don't want to use is a ball. A ball tightens up the intrinsic muscles of the hand. We talked about that in a previous episode. And a ball it also tightens up the palmar arches, thick, heavy ligaments on the palm. The ball is just not healthy to squeeze. And also the ball pushes in here, ends up coming down and pushing on your carpal tunnel. It starts, pushing on the nerve and causing some numbness and tingling. Anyway, it's just not healthy to use a ball. Should use something that's made to be a hand grip strengthener. Even those, the ones with the round coiled spring on the top that you squeeze, those are healthy. Those are healthy as well. And then the handle should be just above the heel of the palm, and that's where it should be squeezed. So when you're squeezing, take a look at your wrist and see what happens when you squeeze. The wrist moves toward the back of the hand. It comes back. Why does it do that? Because when you squeeze, the wrist extensors contract to prevent you from collapsing down toward your palm. So in order for this not to happen as you squeeze, your wrist extensors have to contract and keep your wrist straight. And we look at we'll get to this later. We'll look at the arm, and you see all the muscles on the back of the arm. You see all the muscles on the front of the arm, and there's several different layers. And we'll get to what these muscles are in different episodes. But you can just gain an appreciation that there is a lot of them. Another reason the wrist comes back into extension is for mechanical advantage. So on the palmar surface of the forearm lies the muscles that when they contract, they bend your fingers. So if your hand comes back this way, it's helping to pull them tighter. That's assisting with the grip. So the wrist goes into about 30 degrees of wrist extension with a tight grip. So with the hand grip strengthener, I have people just hold it, and then they hold it steady on the end of it, below the heel of the palm, and then squeeze that with their wrist back a little bit. And also, when you're in a position of a fist, now the tendons from the wrist extensor muscles, the ones that do this, they're wrapped around every joint of the finger. So as you bend your wrist, that forces the fingers out straight, and that's called the wrist-hand synergy. So that's the synergistic movements, because now when your wrist is bent toward your palm, it's pulling these cords on the back of your tendons, and it's forcing the fingers to open. So that's not good for the grip, is it? So when you grip, the wrist should be coming back a little bit into about 30 degrees of extension. So that's some gee-whiz information for you. That's the really key basics of wrist, hand, finger mechanics of making a tight grip. Let's move on to the muscles that bend the wrist. So the muscles on the palmar surface of the forearm will bend the wrist up toward your palm. The muscles on the back surface of the forearm, in line with the back of your hand, will bend your wrist up toward the back of your hand. Now, there's several different muscles, and a couple of them on the palm that bend your wrist toward your palm or flex your wrist. Flexion is bringing things in closer to your body. So when your elbow flexes, you're bringing your hand toward your face. When your wrist flexes, you're bringing it in toward you. Flexion is most important for function because we need to pull food into us and pull other things into us. Extension is mostly positional. It is also for self-defense, as for pushing away. On the palmar surface, the wrist flexors, flexor carpi radialis, flexor carpi ulnaris, we abbreviate those, FCR, FCU. On the back, the extensors that extend the wrist or bring bend the wrist up toward the back of the hand, extensor carpi radialis longus, extensor carpi radialis brevis, ECRL and ECRB, and also ECU, extensor carpi ulnaris. ECU, the terminal tendon, where the tendon connects the muscle to the bone, that's a really common site for tendonitis, inflammation, and pain. There's specific ways we treat that. In future episodes, I want to talk about ECU tendonitis. I want to talk about the TFC and TFCC. I want to talk about stabilization of the distal radial ulnar joint, where the radius meets the ulna down here. And sometimes patients will come in having a lot of pain in that ulnar head right here. You can see it on me. See that bony prominence. You can see it on yourself too. Look at the back of your wrist and you see that pop up. Well, that'll be kind of up a lot. You'll see that bone underneath pushing up the skin. Well, that means they probably fell on it and then tore a ligament in here. Now they have instability of the distal radial ulnar joint. We're going to be talking about that, but let's stay on track with the strengthening. But for now, let's just take a short break. Okay, break's over. Let's press on and talk about strengthening those wrist muscles that we just went over. Now, when the hand comes up, see how it goes off toward the side, toward the little finger a little bit? There's a reason for that. So the end of your radius and ulna, here's the thumb side. Here's the little finger side. See how that slopes? So that slope is here. And when you bend up, the wrist is going to fall toward the little finger a little bit, okay? So sometimes after injury, and we're really focusing, I don't know, I selected such a heavy dumbbell. Usually we'll start with 2 or 3 pounds, for strengthening the wrist. We don't want to try to prevent that from happening. We want to go along the normal anatomy. So what I like to do, and when I'm lifting weights at the gym, I get the back of my forearm on the inside of my thigh right here. So then I'm in a comfortable position. This is straight. And then as it comes up, it can come in and fall toward the little finger a little bit. All right. And I get right in here and then do some wrist curls until I get some pretty good fatigue. Then I can end with the isometric and just hold that steady. Now, to work the wrist extensors up toward the back of the hand, I like to get this nice meaty part of the muscle on the end of my knee. So I can rest here on the end of my knee and get the dumbbell. And I'm down on an angle. See, I'm at about a 45-degree angle. Sometimes you can come up on the ball of your foot and then just raise that up. Gentle. Now on the end range, we don't want to force it. Okay, we brought it all the way up and now we're going to really crank it. Not necessary. All that'll do is just aggravate the tendons. So you just bring it up and slowly bring it down. So bringing it up, the muscle is contracting, right? So the muscle is going into a shortened position. That's called a concentric muscle contraction. When you lower it, the muscle is lengthening. In the weightlifting gym, it's called doing a negative. So when the muscle is lengthening and you're slowly lowering it, that puts the least amount of tension on the origin or where the muscle is anchored in, because if the muscle didn't have an anchor point, it would pull and then not do anything. But so when we're rehabilitating tennis elbow, for example, the first strengthening we would start with is only doing a negative or an eccentric, where the muscle now is starting at a shortened position. Now it's lengthening. Now I'm going to use my opposite hand to pick it up, slowly lower it. It's lengthening. And then once that is really easy, then we go to maybe isometric, where we just hold it. And then isotonic, where we're going up and down. All right. So the reason why I mention all of that is because I want you to have an awareness of there's many different ways of strengthening, and you really should be coached by your hand therapist on how to optimally strengthen for the greatest benefit. Now, the elbow, there's 3 muscles that bend the elbow. So there's the biceps, which everybody's most familiar with. And by the way, the biceps is the prime mover or the prime muscle that does this motion in turning it palm up, forearm supination. So when it's being turned palm up, remember the radius rotates around the ulna, and palm down, the radius is over the top of the ulna. Palm up, the radius is now parallel with the ulna. So now when it's like this, when the biceps contracts, it pulls on this tiny little, see that bony prominence right there? That's where it inserts the biceps and the radial tuberosity. So now it's in there, and now it's wrapped around that bone. So now when the biceps, the real powerful muscle up here, contracts, it's going to pull that and flip it palm up. So if somebody stops you on the street and say, hey, pop quiz, hot shot, what's the prime mover in forearm supination? And you're going to say, well, biceps. And they're going to be really surprised. That is also a strong elbow flexor, bending or flexing the elbow. It's called bi because there's 2 heads. So if we remove the deltoid. That was fun. Remove the deltoid. You see one head of the biceps coming up here, the long head, and it goes over the top of the ball and socket, which is the top of the humerus, and inserts on the top of the socket, which the socket is in the shoulder blade. So it's on the end of the shoulder blade, and we'll talk about that in a future episode when we talk about the shoulder. So that tendon, which very frequently gets some pretty bad tendonitis, and then here's the short head, which goes right up to a bony prominence end of the front of the scapula. Scapula is a shoulder blade, so the front of the shoulder blade, and that's this right here. And then that, so you have one tendon of the biceps that goes to that spot. Then the long head goes up through this groove, the bicipital groove, and inserts right on the top of the socket, right in there. So you got a tendon going through a joint, which that's pretty interesting and problematic. Now, when you're palm up, let's talk about positions. When you're palm up, you're using biceps and brachialis. Brachialis lives underneath the biceps. So if we take off the biceps, look at that, I just took off the biceps. Underneath that is brachialis right here. And you see how that starts, sort of almost mid-shaft of the humerus. And then that also inserts down here. It's called the bicipital aponeurosis. Let's pop off a few more forearm muscles. And you see how they converge on this one common tendon, and that it inserts down here. So you have the biceps, and then underneath that, brachialis. So when you palm up, you're working biceps and brachialis. And then you remember biceps turns the hand palm up. So watch this. If I want to work some forearm muscles, and I want to work my biceps at the same time, I get a hammer. I have several hammers in the office. I got a mini sledge. I got a ball peen hammer. I got the mallet. They're different weights. So we will get into that later. But so you can turn it palm up using biceps. You're using the supinator, which goes from the outside part of your elbow, and it goes across the palmar surface of the forearm, and that rotates that radius around the ulna. Remember I was showing you how the forearm rotates, and it's working the biceps at the same time. And it's working my grip at the same time. So when I palm down, I'm working my grip, the muscles that extend the wrist, the muscles that turn it palm up. When I'm palm up, I'm working my grip, the muscles that flex the wrist, and the muscles that turn the palm down, okay? And when I'm down in this position, and I'm also working the muscles that turn it palm up, I'm also working my biceps. So now let's talk about doing elbow exercises to strengthen the elbow flexors or the biceps. We talked about the brachialis. So when we're in a palm up position, I like to, remember we talked about bending the wrist. I like to get right down in here and do biceps curls, but I'm also working brachialis, okay? Now, if I want to really work the biceps more and I want to start in more of a hammer position, as I come up, turn it palm up, and then bend the elbow the rest of the way, I'm rotating my forearm, I'm ending, so I'm working biceps, brachialis still, and I'm working supinator muscle, that strap muscle that goes over the back of the forearm. Now, let's talk about hammer curls. Brachioradialis. So the brachioradialis bends the elbow when you're in this position. And a lot of people do a lot of these exercises, right? But when hammering, so I'll get patients, they'll come in and they'll say, boy, my forearm, it just hurts right in here. And it's, okay, what are you doing the last few weeks? Well, I've been out around my property fixing fences. I've been hammering a lot of fence posts. All right, that makes sense. Hold it right there. Don't let me push. Oh, that hurts. Is a tendon right here? Yep, that really hurts. Reach out, palm down, straighten the elbow. Yeah, that pulls hard in there. That's a little sore. Brachioradialis. And then we do other testing right on the spot, orthopedic testing. Test other muscles, palpate other muscles, resist other muscles, and really narrow it down and tease it out and really determine exactly, yep, that's your brachioradialis muscle. It's aggravated, it's irritated, it's overworked, etc. Here's what we do for it. So let me just show you the brachioradialis muscle. It's actually removed right now, but it goes from here right down the thumb side. It actually inserts on the end of the thumb side of the radius bone, and so it goes from over here right down along the thumb side of the forearm and inserts on the end. So what I'll have patients do is stretch that by holding the tip of their elbow, you're reaching out straight, turning it palm down, and then also getting a good stretch on the wrist extensors and feeling that pull right through there. Low heating pad wrapped around the muscles of the forearm 2 to 3 times a day, 10 or 15 minutes, and loosen up that muscle. People come in, they're squeezing, they're rubbing it. I have them stop rubbing it because that's only aggravating it further. And then I have them stop the activity that's provoking the symptoms. Just, hey, can't do any hammering for a few weeks. In the gym, don't do hammer curls. A lot of people, they'll get in the gym and get some really heavy dumbbells and just crank those hammer curls. And they're bending they're strengthening the brachialis at the same time too, but that brachioradialis is just getting worked to death. And also, I think last week or 2 weeks ago, I had a woman come in who was carrying a really heavy handbag over her forearm, right over that brachioradialis. It just strained the heck out of that, and we worked the tissues out. And then there's a lot of nice soft tissue techniques we can do in the office with mobilizing the surface of the tissue and doing things like active release technique, and then also to relax the surrounding musculature. I'll even grab the thumb side of the forearm, that radius bone, and then distract it, do a little light traction from where it connects on the end of the humerus, and then even mobilize what's called the prudge, or the proximal radial ulnar joint, and the distal radial ulnar joint, because that affects everything. So where the bones connect, mobilize them on each other, do some traction, which stimulates the muscles to relax. We'll do different stretches in the clinic, educate the patient to different stretches to do at home. That is strengthening the elbow flexors in a nutshell. Extensors, it's nice to get a band or something and put it over the top of the door. It pushes straight down. Also, when doing what we talked about early in an earlier episode, Arnold press, develop a Arnold Schwarzenegger. Palm is facing you, and you push up and see it rotating, and now palm is facing straight ahead. Now palm is facing back. That's strengthening anterior and lateral deltoid and triceps because you're straightening your elbow. Now, another nice one is to lean forward, support yourself, hold your hand on your knee in a stance, and then you can straighten the elbow up against gravity. And that's a good, safe triceps strengthening exercise. Also, when we're bench press working the chest or doing push-ups, that is strengthening the triceps as well. The nice stretch for the triceps is triceps straightens the elbow, right? So the triceps, but I have one right here. It's called tri because there's 3 heads, and they insert down on the tip of the elbow. So when these contract and they pull on the tip of the elbow and it straightens the elbow, now that means that when I bend my elbow, and now the triceps are in their most lengthened position, and they attach up under the shoulder blade. So if I come up like this, bring the tip of my elbow up toward the ceiling, now with my elbow bent, now my triceps are in their most lengthened position. A lot of patients push right here, because sometimes even compared to the other side, they'll go way up on one side, and then this side, ow, I feel that pull a lot right here. Well, they need to start stretching those triceps and even go on the wall as it gets high enough for a nice tricep stretch. And maybe some light strengthening before the stretch, and then a good, a nice, soft, steady stretch beyond that. Now, strengthening the shoulder. We talked in an earlier video about doing cleans. That's a provocative position, meaning it's a position that provokes maximal stress on the supraspinatus tendon, which supraspinatus muscle is one of the main muscles of the rotator cuff, and one of the muscles that's most commonly torn. And this is an empty can position where we do orthopedic tests to test that muscle. And, I used to, years ago in the gym, do a lot of heavy weight doing these cleans. That just is really unhealthy for the supraspinatus. But, also, military press back here, that really compromises the subacromial space where the acromion bone is the roof of bone that goes over the top of the ball and socket. And that is the space where a lot of the tendons of the rotator cuff, supraspinatus, and right here, and then infraspinatus, this is the spine of the scapula, the spine of the shoulder blade, travel through, and then they insert on the top of the humerus, and they move the humerus in different directions. This is a pinch point, and when that pinch point starts pinching, we call that subacromial impingement for pinching. And a lot of you have probably heard about this, but we're unsure of its exact meaning. And impingement is just pinching, and it's called subacromial because this is the acromion bone, part of the shoulder blade, and it's sub or just below that, and that things get pinched off right there. So it goes back to the Arnold press. The Arnold press is really one of the most healthy exercises for the shoulder, for building up those shoulders, and also for supporting the whole shoulder girdle. Rows is really an amazing exercise for maximizing this space. So if this is a pinch point, right, we want to do the opposite. We want to maximize that space. So there's muscles that go down your back that raise the acromion up, and there's other muscles that lower the ball. And if we raise the acromion and lower the ball, and now we're maximizing the subacromial space and having less impingement or pinching on the tendons that connect the muscles that are part of the muscles of the rotator cuff. So one of those exercises is to do a row where maybe you're bent over row and you're pulling a dumbbell up like this. And when you pull, either maybe you're at the gym using a machine, or you have exercise bands on the door and you're pulling it straight back. And then the last little bit, we have muscles on this side of the scapula, or this side of the shoulder blade, that attach to the spine. Those are called the rhomboids. So when you pull those shoulder blades back and you glide your shoulder blade on your thorax or on your rib cage, that is helping to raise the shoulder blade so we can further maximize this subacromial space. All right. So when you do a row, the last little bit, watch my shoulder, when you pull that back, the last little bit, that's all shoulder blade. See that? That's quite a bit. That's all shoulder blade. And then another exercise I have patients do in the clinic is a downward 45-degree push. But now I push, and watch this, watch my shoulder blade. That last little bit, that is serratus anterior. So there's when you see the bodybuilders flex and they got these wings right here, they're rippled, they're kind of like under the armpit that they come out, and they're rippled. That rippled, that's serratus anterior. It's called the push-up muscle. So when you push up and you push forward that last little bit, you push that shoulder blade forward, that works these muscles right in here, serratus, and the way that they're angled, they pull the bottom part of that shoulder blade. So it does this, and look at that, see what that's doing. This acromion bone is raising up. So now we're maximizing the space. So when you strengthen appropriate groups of muscles, those are called force couples. When strengthening the correct force couples will change and optimize the mechanics of the shoulder. The shoulder is made up of two joints, scapulothoracic or shoulder blade rib cage, and glenohumeral or ball and socket. All right. And those have to work together. So as this moves up, the shoulder blade can't stay still, because look at this. The humerus is slamming into the acromion, right? That's impinging. That's impingement. The shoulder blade has to glide on the rib cage to allow the arm to come up. And the shoulder blade goes about this far. No plastic model is perfect, but that gives you the idea. As it moves up, it moves that roof of bone up out of the way. The roof of bone gets moved up out of the way. So just as some additional information, patients will come in, and a lot of times older people, where they say, I get about here, and then it just hurts like heck. I can't go anymore. And then I'll take a baseline measurement and say, okay, you're starting to have pain about 90, 95 degrees. Now let's look at those shoulder blades. stand up, look back at the shoulder blades, shrug, moving forward, moving back, raise your arms up. When they raise their arms up, the left shoulder blade is rotating up nicely. That right shoulder blade, the one that's where they're having pain, is kind of stuck. It's not moving. Well, those other muscles we talked about earlier, rhomboids, for example, they get really, really tight and they're having a tethering effect and they're holding that. So I'll have patients sit down and then I'll have them kind of recline into my hand and I'll take that shoulder blade and I'll push that shoulder blade as they're, I'll just have them come forward and I'll push that shoulder blade forward and stretch those rhomboids. Okay, and then bring it back. And then I'm going to push it like this, really push that back, and they'll feel a stretch in their chest, open all that up. And then I'm going to tilt it back to the posterior tilt, just stretch everything in front, open that up. Then I'm going to have them raise their arm. And then when they raise their arm, I'm just going to put overpressure and make that shoulder blade move and stretch those muscles that are tethering it and then restore normal motion. And I'll say, okay. And sometimes I'll lay them on their side and do all that and mobilize things and do a lot of extra fancy stuff. Okay, sit up. Now, don't think about it. Just raise both arms. And then all of a sudden they went from this till they sit up. And this is after like 5 or 10 minutes of treatment. And they're shocked. I said, look up, look how high your hand is. Wow, I'm not feeling any pain. You know what? We restored the range of motion of the scapulothoracic joint or the shoulder blade rib cage joint. And now it's moving freely and you just restored the mechanics of the shoulder complex. All right. And then that in combination with specific strengthening and some stretching at home really does the trick. But, again, it depends on how long has this been going on. Has the person been ignoring this for a year and allowing it to progress? This is going to take longer to get better. But it's all about restoration of the mechanics, doing the proper stretching, the proper strengthening. Doing the wrong strengthening is really just going to beat a person up, So things have to be done right. What's right is right and what's wrong is wrong, as they say. So thanks for listening. Let's talk about some more things in future episodes and figure more stuff out. All right. Thank you.